Vaccines are being mainly distributed through clinics run by the county, but community providers like Desert Oasis Healthcare play a crucial role in making sure everyone gets vaccinated. I spoke today with Lindsey Valenzuela from Desert Oasis Healthcare. Lindsey, thanks for joining us.
Oh, thank you for having me.
Tell us how the process has been distributing vaccines as a community provider. What's involved?
It's been an experience. It's been a very exciting experience. From receiving vaccine directly from Pfizer and the use of our new freezers to trying to bring together community members and our own patients in a really efficient manner. It's really been an amazing opportunity to see our community members back in our offices after so long.
What population are you vaccinating right now, and have you been able to vaccinate members of the general public yet?
So we originally started with vaccinating people in phase 1A. So those are healthcare workers, people in the healthcare industry. So that was a number of our staff members, a good portion of them, as well as other offices, healthcare offices in the Valley. After the first 3 weeks, we transitioned to vaccinating 65-year and older members. And we've been really focusing on our membership based upon the supply that we've been receiving from the county. So that has been really wonderful over the last 3 weeks. Next week, we start our second dose vaccinations for our members. And so far, everything's gone very well. We've gotten really good reports from our members.
Great. And I think you just mentioned, but you receive vaccines directly from the county, correct? Has any shipment been smaller than expected? And if so, has that resulted in canceled appointments for people?
So there's a couple of ways that we've received allocations of vaccine. And initially, we received them directly from the manufacturer, from Pfizer, and that was for vaccinating our staff. After that, we did receive allocations directly from the county, which was very helpful for us to continue to vaccinate our members. Those allocations were a little bit smaller than those we were receiving from Pfizer, but in the last 2 weeks, the volume of vaccine that we received has gone back up. And we've received 2 weeks of over 1,000 doses for Palm Springs and over 1,000 doses for our Indio location to continue to be able to give first doses and now second doses. So it really has been a week-to-week process. The county has given us a liaison that we've been communicating with on a weekly basis to understand what our allocation will be. What we understand from the county is that the county is really hearing from the state about their own allocations on that same weekly basis. So we're getting as timely information as the county can offer us.
What is the demand for the vaccine that you're seeing? And you just mentioned guidance from the county. Are you getting that in terms of who to vaccinate, or do you mostly decide on your own?
The guidance that we receive from the county is very clear in terms of the vaccination tiering system. So again, we started with 1A, which was primarily healthcare workers. And I think the goal was there to try and take care of the people who take care of our community members. As it transitioned into phase 1B, we saw more essential workers and 65-year and older community members on that list. We're not really in a position to make up our own rules. We really go with what the county has let us know we should be doing. And their communication has been very clear with that. And what's nice is the county's communication with us has improved and been more frequent over the last couple of weeks.
So far, it's been a state strategy to get as many first doses into people's arms as possible, which has led to some supply worries about people receiving the second dose. Have the clinics been focusing more on first doses as well, or have there been any issues scheduling second dose appointments?
Well, the guidance that we've received is what you get for your allocation, you should attempt to use throughout the week, and you will be guaranteed additional allocations. To this point, that has proven true, and we haven't had to reschedule any of our second doses. We hope not to have to reschedule any second doses going forward. What we're hearing from the county is that they're really working within the CDC's 6-week guideline. So all of the Pfizer trials were done over a 0-day and then 21-day second dose time period. But the CDC has allowed for that second dose to be given up to 6 weeks or 42 days after the first dose.
How is the vaccine process now compared to just a month ago? Have you noticed a difference, say, in public frustration and confusion?
Well, initially, when we were in phase 1A, the expectation from the public was that we are only vaccinating healthcare members and staff and people who work within the healthcare industry. As the state transitioned into allowing those who are 65 years and older and more of the essential workers, I think what we heard from the public is our expectation is that we would be vaccinated, but what we have is a demand for supply that we haven't yet met in order to meet all of those needs. Now, Desert Oasis has 30,000 seniors in the Coachella Valley, and we've been getting between 500 or 600 to 1,100 dose allocations a week for each of our 2 locations. So it is taking some time to get through all of our members, and there has been a little bit of frustration trying to understand how the county is allocating to their mass vaccination county sites versus more private providers like Desert Oasis Healthcare.
You have clinics throughout the Coachella Valley, including in the East Valley. How have vaccination clinics been there, and what are efforts like?
Well, we really were very keen on opening an Indio site, and that's because if you look at the COVID-19 infection rates, death rates, they're much higher for our population in the East Valley. So we really wanted to focus our efforts on that population. What we also found is as we're vaccinating 65-year and older seniors, those older seniors, those who are 75 years and older, have a lot of difficulty navigating some of the online scheduling tools that the county is using for their vaccination efforts. So we've really tried to focus on phone calls, personalized touches for those members who are 75 years and older in the East Valley to help them connect with us and get those appointments scheduled, because we recognize that if we don't do that for them, they're unlikely to be able to participate in vaccination. We really want to support that part of the population.
What about teachers, and what should they know about getting the vaccine?
So we have been talking with the teachers in the different school districts around Coachella Valley, and we put into place some initial planning for when we have sufficient supply to be able to vaccinate their staff. I think all of us can agree that we want to get our kids back to school, but the county's messaging to us has really been, for now, for the next week, try and stick to your 65-year and older. And as we get more information about how the transition in California will happen with Blue Shield signing a contract and entering into that distribution role, how that will affect our ability to do a mass vaccination for teachers and staff of the school districts.
And finally, if someone is interested in getting the vaccine at one of your clinics, what do they need to know?
Well, currently with our supply, we're focusing on our members, but I would encourage them to continue to reach out to the county. They can also give us a call in the coming weeks and see if our process has changed for our ability to vaccinate non-members, to vaccinate community members. And that may be something that happens down the road as Blue Shield enters the spectrum with distribution of vaccine.
All right. Lindsey, we appreciate your time. Thanks for joining us.
Oh, thank you.